My name is Randy Goen. I was diagnosed with scoliosis when I was 15. When I was about 17, I had a boating accident and damaged my neck, which caused a lot of neck pain. When I was early 30s, I started doing pain management. I took every oral pain medication that there is, just about. And after you take it a year or two, I switched, and I did all the injections, I did physical therapy, pretty much everything that you can do to try to relieve pain, I did it. My wife and I had a vacation planned for our 25th wedding anniversary to Hawaii. Because of the pain and my inability to walk far distances, we ended up canceling that vacation. About that same time, we met Dr. Hostin, and I actually found him online. And he was not the only doctor that we found, but after meeting with him and talking to him about my problems, he was the guy that we decided to go with, and it's just been a blessing. My life has changed for the better. I wish I had met Dr. Hostin 10 years ago. He may not have done the surgery, but I would have tried to get him to do the surgery. But now I feel great. We were able to do our vacation to Hawaii in about a year and a half after the surgery, and everything's great. I feel wonderful.
So Randy's story is pretty typical of a lot of our adult scoliosis patients. So he'd had a curve for a lot of years. It was not a mystery that he had scoliosis. And for most of his adult life, he'd done quite well, even though he had a fairly large curve. But as he started getting into his 50s, he really started to struggle a lot with pain symptoms. And he'd been through a lot of treatments, physical therapy, anti-inflammatory medications, massage, pain medicines, and was really starting to get worse and worse. And he was a young, fit guy still. And I think, if I remember right, he actually had to cancel a big trip for his anniversary, I think his 25th anniversary with his wife. And that's when they realized, listen, this is really starting to affect my quality of life. I'm not able to do the types of things I want to do. I'm living with daily back pain that's really affecting my enjoyment of spending time with my wife and family. We talked a long time about, is it the right time to do a scoliosis surgery for him? It's always one of the hardest things for us to decide. When people come in, we get an x-ray, we know what their curve size is, and we know we could fix them. The question is, are their symptoms bad enough at this point in their lives to justify putting them through a large scoliosis correction in adulthood? And I think for Randy's case, he had really gotten to the point where he was there, and we could not get him to settle down in terms of symptoms without surgery. And he's somebody that's done great with surgery. I think I was shocked at how quickly he got back to just everything normal in his life. And it's been a couple years since surgery, and he's hasn't really looked back. He's doing everything he wants to do day to day with a wife. And I think if he had to say anything, probably it would be maybe he should have done a couple years earlier in his case.